September. Today we're going to be discussing anxiety and ADHD. My name is Leslie Crescent. I'm the school psychologist here at Virgil Mills.
Hi, I'm Alex Corona, school social worker here at Mills.
So, anxiety and ADHD are both very popular topics, and we see them a lot within our children here at school. So, the question that we're going to be trying to answer today is it a phase? What is anxiety? It's a normal part of everyone's day, or it can be a normal part of everybody's day. So what's the difference between the normal part in childhood and the phases that students go through? Just like, oh, I'm scared of monsters, or I'm only going to eat certain color foods, or I have to not step on the crack. Some of those things are common day-to-day bits of worry. Now, anxiety, what really defines that is that it's not temporary. It's persistent and irrational worry or fear that interferes with daily life activities. So anxiety disorder can be chronic and interfere with child's functioning, not only here at school but also at home. You might see distress or them being uncomfortable with some normal activities. They might try to avoid certain places or people, things that they like to enjoy or that they used to enjoy. So obviously that looks very different with every single individual. Going through different ages, it's going to look very different in a 5-year-old than an 11-year-old. It can look very different in males and very different in females. So some of the signs and symptoms that you might see are listed above, and some we might not think of. So agitation and restlessness, that can commonly look like ADHD or signs of hyperactivity, and really that can be some signs of anxiety. So it's important to pay close attention to the surrounding things that are going on during that time. There are a number of different types of anxiety, and each of these are going to look very different. I've listed a couple above, and panic disorder is going to look very different than selective mutism, but they all fall under the umbrella of anxiety. Unfortunately, there are other disorders that are common when we are talking about anxiety that are comorbid, meaning they go together. So often when you see anxiety, you might also see depression, or you might see co-occurring types of anxiety. So you might have generalized anxiety disorder with separation anxiety disorder. Substance abuse can also be something later on down the line that can be developed with anxiety disorder, often used as coping mechanism, and then behavioral problems.
All right, so let's talk about ADHD. So ADHD is a brain condition, and it's kind of like your brain's going super, super fast, and you can't slow it down. So when we're looking at ADHD, there's two different types. There's inattentive and hyperactive types. You can have some of both, inattentive and hyperactive. You can have just inattentive, or you can have hyperactive. Some children with the inattentive behaviors will see maybe the can't focus. You have to redirect them back on task. The hyperactive, restlessness, can't sit down. And we want to look at both of these in different settings. So not just in the school system, not just at home, but it has to be in two different types of settings. So what to look for when we're looking at the signs and symptoms? Often fidgets, squirms, has trouble staying on task, has trouble staying in their seat, have trouble playing quietly, extremely impatient, can't wait. Those are some of those hyperactive symptoms. For inattentive, maybe has some trouble organizing, often fails to finish their work or schoolwork or chores at home, kind of goes to the task but doesn't has trouble finishing it and can't come back to it, or comes back to it at a later point. Often loses homework and then homework assignments, classwork, jackets, things like those type of things. Okay, so the additional information I was talking about is the setting and time frame. So for the setting, it needs to be in two different types of settings. It's not just going to be at school, at home. You're going to see it probably in both settings. And then for the time frame, it has to occur more than 6 months. So when looking at that, maybe talking with the teacher or your doctor, saying, hey, I've seen this going on for a long time, you want to look at that time frame. And age also plays in a factor. Is it just being a normal 5-year-old kid? Are the kids in his class the same age in his class? Are they having the same problems, or is it greater than the kids in his class or maybe his siblings?
Right, Alex, that's actually a really good point, something that I missed when we were talking about anxiety. You want to be looking at whether or not it's comparable to others of the same age. So actually, there is research that says that if you are looking at, say, a kindergarten student, the research says if you ask one of these two questions, it is helpful in predicting whether or not a child has anxiety or will be developing anxiety. So the first question is a child more shy or anxious than other children his or her age? If the answer is yes, then there's a higher degree of predictability of anxiety. And then, is the child worried more than others his or her age? So again, looking at comparable peers is going to be important. Moving on to some tips for anxiety. So again, talking about persistent fears or worries that interfere with daily life. So comfort and reassurance isn't going to be enough for this type of behavior. So teaching coping strategies is probably one of the best tips, and it's probably one of the most difficult because you really want to be interactive with it, and it has to be practiced daily. Listening to your child's feelings. I've got some things about what not to say. We'll mention those in a minute, but definitely listening is going to be a big one. Often just being able to express, your child being able to express those fears and worries gets them out of their head and can be very helpful. Staying calm when they become anxious in a situation or an event. And recognizing and praising those accomplishments. So when they do overcome worries or fears, that's definitely going to be something that you want to praise them for. Not punishing mistakes or lack of progress. Being flexible, but also trying to maintain that daily routine. It's definitely a balance there because you want to make sure that things are somewhat predictable, but also students and your child needs to be able to adapt to change. Change is definitely something that can bring on anxiety, but again, going back to those coping strategies, teaching those coping strategies will allow them to be more flexible and to adapt to change. And prepare and plan for those changes and transitions. So allow for extra time in the morning if school is something that's difficult. Try and build in those strategies around areas that you know your child has anxiety with. Talking with a teacher, counselor, one of us is student services about your concerns. So if you would like additional tips or if coping strategies, what does that mean? What do those look like? What would that be in this particular instance? We would definitely be able to help you with support with that. But here are just a couple coping strategies. So practice relaxation strategies. If you do a little bit of a Google search on this, there are some very helpful things out there. We talk about belly breathing. We also talk about smelling the flowers and blowing out the candles. Those are things that have children focus on their breathing and calm them down. They bring the heart rate down, and that often helps bring that tension down as well. Write it down. So journaling is a really great way to, again, as I mentioned, get the ideas that's in your child's mind out onto paper. maybe they're too young to journal, you can definitely help them with this. They can verbalize it to you. You can write it down from them. Talk it out. That's another one. Retraining the brain. Again, those are, building in those coping strategies to recenter the brain, to retrain it in those stressful situations. And then gradual, systematic facing those fears. So slowly introducing the area or the situation that brings about the fear or the anxiety for the child, and giving them the maximum amount of support at first, so that way they can get through it, and then gradually pulling that back so that way they're independent with it. That is definitely a great strategy when we're talking about practicing and retraining the brain. All right, some tips of what not to say when a child is very anxious, in a moment of anxiety or worry, and feeling very stressed. Calm down. Doesn't really help. Get over it. This will pass. You're fine. It's not a big deal. It is a big deal. That's why they're feeling the way that they're feeling. So telling them it's not a big deal, not very helpful. Just forget about it. Just ignore it. It's all in your head. Put on your big girl pants. Not helpful. These are all things that, if the child could just easily get over it, they would be just easily getting over it. They, again, persistent and persistent worry. It's there all the time, or it's there during the situation all the time. They're not just things that they're going to get over, so they really need that support and the strategies and the coping mechanisms that were mentioned.
Some tips with students with ADHD. If a student is very hyperactive, you're definitely going to want to get that physical activity in. And that can look like in many things: sports, playing outside, just anything to get them moving, get their blood moving. Students with ADHD tend to be forget, so you're going to want to write things down, teach them to write things down, make lists, keep a notebook, have them learn those organization skills, because that is what they're going to struggle with, and this is going to help them down the line when anything in life, really. You want to have them have a consistent routine, so a schedule that's the same every day, just so they know what's coming. That's going to help with them staying organized, staying on task. They know what they have to do during this hour, etc. Diet and nutrition is going to be huge. Nutrition and what they're eating can also play a big factor. Sleeps. You want to have a great sleep schedule, because that's going to play a huge factor into students with ADHD. You can break things up, break tasks up, especially if they aren't very good at finishing things. You can break it into chunks. That could help them. Timers to keep their time management skills. Limit screen time. I think that's it.
All right, we're going to take some questions from the audience, but we want to remind you that our next speaker series is going to be December 17th, and we're going to be talking about is it bullying is the topic. So thank you for tuning in today, and we will see you next month.
Thank you.